Ancient Egypt, around 1500 BCE. The Nile is pulled back after the flood, leaving the fields dark, wet, and ready for planting. You are walking barefoot through the mud with a bundle of reeds balanced against your shoulder when something sharp disappears into the bottom of your foot. You stop. A broken reed is punched through the skin near your heel. It hurts, but only for a moment. You pull it free, squeeze out a little blood, wipe your foot against the mud, and keep walking. There is work to finish before the sun climbs higher. By evening, you have almost forgotten it. The wound is smaller than a fingernail. No broken bone. No animal attack. No dramatic pool of blood. Nothing that looks capable of killing a healthy adult. That is what makes infections so dangerous. The original injury does not need to be large. It only needs to open the door. Bacteria already live on your skin, in the soil, in the water, and on the piece of reed that entered your foot. You cannot see them. No one in your village can see them. The first microscopes capable of revealing bacteria will not appear for more than 3,000 years. For now, the wound looks empty. It is not. The invaders are already inside. The next morning, the skin around the puncture is red. You press it with your thumb. Pain shoots upward through your ankle. By the second day, the foot is swollen. The skin feels stretched and hot. You cannot place your full weight on it. So you begin walking on the side of your foot. Your family notices. You tell them it is nothing. That answer makes sense because you still feel mostly normal. You are hungry. You can talk. You can work if you move slowly. But beneath the skin, a war has started. Your skin is one of the strongest borders your body owns. When the reed broke through it, bacteria entered warm tissue filled with moisture and nutrients. They began multiplying. Your immune system responded almost immediately. Blood vessels widened. Fluid moved into the damaged area. White blood cells followed chemical signals toward the wound. That response creates the four things ancient healers could recognize even if they could not explain them: redness, heat, swelling, pain. These signs do not mean your body has already lost. They mean it has noticed the invasion. The swelling helps bring immune cells into the area. The heat comes partly from increased blood flow. The pain discourages you from using the injured foot while tissue is being repaired. For a small infection, that response may be enough. Your body can trap the bacteria, destroy them, and rebuild the damaged skin. But this time, the microbes are dividing faster than your defenses can contain them. By the third night, you wake shaking beneath a blanket, even though the air is warm. Your wife places a hand against your forehead. You are burning. The wound is no longer a problem in your foot. It is becoming a problem for the entire body. Your family takes you to a healer. He does not wear a white coat. There is no hospital, no laboratory, and no bottle labeled with the name of the organism inside your foot. But he is not helpless. Ancient Egyptian medical writings show that healers could examine injuries carefully, describe swelling and fever, clean wounds, apply dressings, and decide whether a condition could be treated or was too dangerous to promise a cure. A medical text, now called the Edwin Smith Papyrus, survives from around the 17th century BCE, probably copied from knowledge that was already much older.
Others received the darkest
describes
verdict,
48
an
injury
ailment
cases
not
with
to be
observations,
treated. Your
examinations,
healer washes the
treatments,
wound,
and judgment.
flies circle near
Some
the doorway,
cases are declared
so an
treatable.
assistant pulls a
Some are
woven screen
described as
across the
conditions a
entrance.
healer should fight. Others receive the darkest verdict, an ailment not to be treated. Your healer washes the wound. Flies circle near the doorway, so an assistant pulls a woven screen across the entrance. A clay bowl of water sits beside folded linen strips. Bronze tools rest on a low wooden surface, polished but not sterile. He presses the swollen tissue, watching your face as pain moves through you. A pocket of pus has formed beneath the skin, so he opens it to release the pressure. You grip the edge of the mat while thick fluid drains into the bowl. There is no anesthetic, but the release of pressure brings a few seconds of relief. Then he applies a dressing made with linen and honey. To modern eyes, the honey may look like superstition. It is not entirely. Honey draws water away from microbes, creates an acidic environment, and some types produce antibacterial compounds. Modern research confirms that medical-grade honey can inhibit bacterial growth and support wound healing in certain situations. The ancient healer does not know the chemistry. He only knows that some dressed wounds heal better than dirty wounds left open. The linen absorbs fluid. The honey coats the injury. A bandage keeps new dirt away. For a shallow wound, this may be enough to save you. But your infection has moved deeper than the honey can reach. The treatment is intelligent. It is simply arriving thousands of years before the tool you actually need. For several hours after the wound is drained, you feel lighter. The pressure falls. You drink water. You even ask for food. Everyone takes this as a good sign. Your family begins talking about tomorrow. Someone brings fresh bread. Your son asks whether you will return to the field. Then the fever returns. A red trail begins moving from your ankle toward your calf. The lymphatic vessels beneath the skin are inflamed as the infection spreads through the pathways that normally carry immune cells and fluid. Your breathing becomes faster. Your heartbeat pounds against your ribs. You feel cold, then hot, then cold again. This is the point where infection can become sepsis. Sepsis is often described as blood poisoning, but that name misses the most frightening part. The bacteria are dangerous, yet the body's response can become dangerous too. Your immune system was built to fight locally. Close the wound, trap the invader, destroy infected cells. But when the alarm spreads everywhere, the response can lose control. Blood vessels widen across the body and begin leaking fluid. Blood pressure falls. The heart beats faster, trying to keep oxygen moving. The kidneys receive less blood. The brain begins to malfunction. You struggle to understand simple questions. Your family thinks you are falling asleep. You are not. Your organs are beginning to lose the circulation they need. A modern emergency department would treat this as a race measured in minutes. Doctors would take blood samples, give intravenous fluids, support your blood pressure, drain infected tissue, and begin antibiotics as quickly as possible. Your healer has honey, linen, clean water, a blade, and experience. He has already used all of them. There is no hidden medicine left in the room. As your condition worsens, everyone searches for a reason. Maybe the flood water was unclean. Maybe a spirit entered through the wound. Maybe a god is punishing an oath you broke or a ritual your family performed incorrectly. Ancient Egyptian medicine did not separate practical treatment and spiritual belief as cleanly as modern medicine does. A healer could clean and dress a wound while another person spoke a protective spell. Honey and prayer could exist in the same room without seeming contradictory. That was not stupidity. It was what humans do when part of a problem can be observed and the rest remains invisible. Your family can see the red skin. They can smell the wound. They can hear your breathing change. They cannot see bacteria dividing inside tissue or inflammatory chemicals spreading through your blood. When the mechanism is hidden, the mind fills the gap with a story. Bad air, angry gods, corrupted body fluids, a curse. For thousands of years, humans watched people die from infected wounds, difficult births, bad teeth, pneumonia, and minor cuts. They learned useful patterns. Wash this, drain that, cover the wound, remove dead tissue, use honey, use wine, keep flies away. But they could not reliably explain why one person recovered while another died from what looked like the same injury. The difference might be the species of bacterium, the depth of the wound, the amount of contamination, the condition of the immune system, or simple luck. To your family, none of those answers exist. So when the healer finally lowers his eyes, they do not blame a microorganism. They prepare an offering. You will never know why the wound killed you, but the answer will come. It will just take more than 3,000 years. In 1847, Ignaz Semmelweis notices that women examined by doctors coming directly from autopsies die far more often after childbirth. He orders the doctors to wash their hands with a chlorinated solution. Deaths collapse. 2 decades later, Joseph Lister begins cleaning wounds, dressings, and surgical instruments with carbolic acid. Medicine has finally learned the first rule: stop carrying the enemy into the wound. But clean hands can only prevent some infections. They cannot chase bacteria already spreading through blood, lungs, or bone. That weapon appears in 1928. When Alexander Fleming notices mold-clearing bacteria from a laboratory dish, he calls the substance penicillin. For years, it remains a promise trapped inside a petri dish. Then, in 1941, doctors give a small supply to a policeman named Albert Alexander, whose face and lungs are being destroyed by infection. Within a day, his fever falls. The infection retreats. The drug works so well that doctors recover penicillin from his urine and give it back to him. Then the supply runs out. The bacteria return. Alexander dies. Humanity has finally found the weapon. It simply cannot make enough ammunition. War changes that. By 1943 and 1944, factories are producing penicillin on a massive scale. A medicine, once measured in laboratory drops, is now being packed for wounded soldiers. Infections that had killed people for thousands of years begin retreating after an injection. The entire revolution arrives too late for you. Not by a few days. By more than 3 millennia. Return to the field. The broken reed enters your foot. The cut is tiny. In ancient Egypt, it may begin the final week of your life. Today, the same injury would probably become an inconvenience. You would wash it, remove any debris, watch for swelling. If infection developed, a clinician could drain the wound when necessary, identify the likely bacteria, and prescribe an antibiotic when appropriate. You might complain about the appointment. You might forget to finish your lunch because the pharmacy line took too long. Then, a week later, you would struggle to remember which foot was injured. That forgetfulness is one of the clearest measures of medical progress. Antibiotics did not only defeat famous diseases, they made ordinary dangers boring. A cut from a kitchen knife, an infected tooth, a wound after childbirth. a scratched knee, a puncture from a thorn. Historical reviews suggest that cellulitis and erysipelas killed roughly 11% of patients in the pre-antibiotic era, about 1 person in 9. Now, many cases are treated successfully before most people understand how dangerous the same infection once was. But the story does not end with victory. Bacteria evolve quickly. When antibiotics are used unnecessarily or incorrectly, resistant organisms gain more chances to survive and spread. Some infections are already becoming harder to treat. The ancient world has not vanished. We have built a wall between it and ourselves. That wall is made from clean hands, sterile instruments, vaccines, sanitation, rapid diagnosis, and antibiotics used carefully. Remove enough bricks, and the old danger returns. The red skin, the fever, the confused patient, the family waiting beside a bed while the healer has nothing left to offer. For most of human history, death did not always arrive as a lion, a war, or a plague. Sometimes it arrived through a cut smaller than your fingernail. You wiped away the blood, kept working, and never realized that the most dangerous thing inside the wound was something no human being would learn to see for another 3,000